today I am 4 days post-op. I haven't checked in for a couple of days, purely because I've just been, trying to keep on top of things, keep pain levels down. So I'm going to go back to surgery day and waking up from my surgery. When I last spoke to you, I was just waiting for him to come and get me, take me down. Not a bad experience, to be honest. Aggie came up to get me. They took me down to theatre, put the cannula in my arm and drifted off to sleep. Next thing I know, I woke up in recovery with a very nice team around me checking I was okay. And when all was good, I got taken back to my room. I found most of surgery day it was a hard day for me. I found it quite hard. The pressure I was experiencing in my chest isn't what I was expecting it to be, and it panicked me quite a lot. But once, all the sort of painkillers kicked in, I wasn't too bad, and by the afternoon I managed to get myself out of bed to do little tasks like go to the toilet. I did have to have a bit of help with sort of drinks and food because I couldn't get my hands up to my mouth. But by day 1 post-op, that was all good and I could do all those sort of normal things myself. So the following day, which was day 1, I was allowed home. Mr. Richards and Aggie came to check on me that morning just to make sure everything was a-okay. I was given some painkillers to take home and I went on my way. By that afternoon I was feeling quite good. I was feeling quite comfortable. The painkillers were all working, so I even managed a brief trip to the local pub just to get out of the house for an hour or so, just to get me up and about so I wasn't sitting around moping. We did that, came home. We didn't have too bad a night's sleep. Woke up about 2 AM, took a couple of paracetamol that got me through the rest of the night until the morning. Day 2, again, quite a comfortable day, and just kept taking the painkillers at regular intervals. They try us eating properly, getting plenty of fluids inside me. I was beginning to notice I had quite a lot of bloating in my stomach, which not really I can do about it. Got to sit that one out. But by that point it was beginning to look quite bigger. It was probably slightly more uncomfortable than my breasts themselves were. So now I'm on day 4 post-op. Again, still recovering. Painkillers I'm still taking at regular intervals. I do notice the effects when I wear off. I begin to be able to do most tasks myself. I can get up, I can get dressed. I'm having to still sleep in an elevated position. I can't be too flat because I find it very difficult to get up in that position. I could do most tasks at home, really, get my lunch, make a cup of tea, provided I don't have to stretch too far. If I stretch, I do feel it. Generally, pain-wise, I'm not really in that much pain. So again, it's the bloating. The bloating is slightly uncomfortable, but my breasts themselves are fairly pain-free. Get the occasional sort of twinge now and again, but other than that, I'm not doing too bad. I feel quite happy and comfortable with the whole process so far, really. Plan to go for a little walk later just to get up and get a bit of exercise, get the blood going, and get a bit of fresh air. It's a nice day out there, so I get a little potter to the local shop and back, which will only take 15 minutes. So nothing too strenuous, just to get me up and about and out of the house. And I shall try and check in again tomorrow and let you know how I'm feeling. and in a couple of days time I'm going back to the hospital just to get my wounds checked and hopefully change my bra, and I can start thinking about having a shower, which will be nice. And I shall see you tomorrow.